This important national launch comes after the global launch of the report on the 6th of September 2018 in the United States, which set out new heights for quality health systems in the new Sustainable Goals era. Let me first start by congratulating the Lancet Global Health Commission, the team of health experts, including the Harvard T.H. Chan School of Public Health, the World Health Organization, our very own KEMRI Wellcome Trust, and development partners for their tireless work on this publication. This report challenges our thinking in our definition of quality health. It urges us to raise the bar for our health systems, placing high-quality care as a key for better health outcomes. As a commissioner of the Lancet Global Commission, I have added my own voice to support the work of the Commission because I personally believe in the concept of quality healthcare, care that centers on one basic principle, the idea that patients are people, whole, integrated people who need to be addressed holistically to be healed. The report resonates with my initiatives, Beyond Zero strategic framework, which prioritizes wellness and people-centered approach for health. From my own work in Beyond Zero, I'm aware of the negative experiences people face due to lack of quality care. Marginalized and vulnerable people, including women and children, the elderly, persons living with disability, and the less educated are most affected. I therefore commend the Ministry of Health for their leadership in this conference as a demonstration of Kenya's commitment to embracing the recommendations of the report. I applaud the county governments for the investment in healthcare. I thank you all for your presence here and call on you to be crusaders of quality care movement so that we can forge ahead as a country in our collective pursuit for universal health care, leaving no one behind. Poor health systems are an impediment to the growing demands and expectations of our people's health needs as a fulfillment to their right to health. As we have heard, according to the report, 52,000 deaths occurred in 2016 due to poor quality health systems. Of those deaths, 32,000 were as a result of lack of access, while 20,000 were due to poor quality care. The current disparities in the quality of services offered between public and private facilities across the regions and towns is the major challenge facing Kenyan health system. Yet laudable progress has been made to ensure healthcare affordability and accessibility through cost reduction, infrastructural expansion, and other policy pursuits. The Kenya government-sponsored National Health Insurance Fund program and the free maternity super cover are some examples that are in place to protect our citizens, especially our women and children, the poor and the vulnerable communities. But we must begin to pay closer attention to quality care and build resilient health systems that Kenyans can trust and have confidence irrespective of the facility that they visit. The report we're launching today urges us to critically examine the quality of care we are providing for our citizens. This has become a true reality, and this is why today's event is so important. No longer can we perceive quality care as a right preserved for the rich or something that our country will pursue in the future. The Lancet report conclusions lay with the emphasis on quality care as a big win strategy that will accelerate gains we have made in achieving our health-related SDG 2030 targets. We as a country have taken some steps towards enshrining the principle of patient-centered service in our health systems through the Kenya Quality Models for Health Guidelines developed in 2012, alongside the Joint Health Inspection Report, both developed by the Ministry of Health. These two documents will not only help in including quality care as an integral part of health care delivery, but may also help provide us with a local roadmap for improved national health outcomes. The recommendations from the Lancet report urges for enhanced governance and reorganization of health services so that we do not lay emphasis on access only. It calls for people-centered, modernized curricula for pre-service and in-service training. It calls for system-wide action, a health system that listens more, cares more, is more concerned with excellence, and is more responsive to the needs of the people it serves. These recommendations require strategic investment from all our health partners. I recognize you for your presence here and thank you for your continued support. The conference discussions over the next 2 days will examine the recommendations of the report alongside our own country's efforts and actions for quality within our local context. We will grapple with establishing the definition of quality, but even as we grope for an appropriate, standardized perspective, we recognize that quality healthcare is crucial for the health of individuals and families and for cultivating trust in the public health system. As I conclude, I thank you all once again for being here to join hands, share ideas, and propose actions that will help accelerate Kenya's journey towards quality healthcare.